Well, if any of you suffer from joint pain, then you know how agonizing it can be and how frustrating it can be to find the right treatment. Well, a lot of doctors use steroids, but that has a lot of side effects, according to our next guest and our sponsor, Dr. Cecil Graham, Medical Director of AZ Pain Centers. Good morning, Dr. Graham.
Hi, Andy.
How are you doing today?
Good. Good to be back.
Let's start off with probably a simple question, but we can explain it to me and all of our other viewers. Where are your joints located in your body?
Well, you have many joints, of course. We have a photo. You have your major joints, which
Right.
your shoulders, your elbows, your knees, your hips. But you have many joints from the base of the skull all the way down the spine. Each spinous process is technically where a bone comes together as a joint space.
Okay.
At the base of the spine, where the pelvis and the spine come together, that's the sacroiliac joint. And so you can get inflammatory responses at any of those.
Well, why do you think it's so common to get joint pain?
Basically because you have so many joints in your body.
Right.
So,
one of them's bound to get all messed up sooner or later, right?
Any activity at all can cause a simple sprain, a strain of a joint. Osteoarthritis, if you take a x-ray of the 65-year-old population or older, 85% of that population has evidence of osteoarthritis. So it's extremely common.
Well, how can you guys help all the folks out there that do suffer from joint pain?
What we do, I think, that sets us apart from others is we have a non-steroidal substance that we inject into the articular surfaces, into the joint spaces themselves. Steroid compounds with repeated injections into the joint spaces can cause bony erosion, or the cartilage that is where the bones come together. You have cartilage that actually keep the bones from rubbing together. And so steroid substances can cause a degeneration of that over time with repeated injections. So the substance we use has no side effect profile that's ever been documented and used safely for over 25 years in this country and much longer in Europe.
So do you think most doctors, that's sort of their fix is the steroid treatment? That's what a lot of them use? Absolutely.
I mean, if you look into medical research and what's been used in the MD population for many, many years, that's what they're familiar with. That's what they know. And it does work. But again, you have a big side effect profile that you have to weigh the risks and the benefits when you use it.
Right, and then you go from having one thing wrong with you to having more things wrong with you, and obviously you just want to feel good. Absolutely. What is the typical, when someone makes an appointment with you, how does it work? You get x-rays, and is it a pretty long process?
We do a lot of physician referral, but patients can call us directly. We treat everyone. We look at it and see is there something that's been missed. So a lot of times they'll bring their MRI studies, x-ray studies with them, but when we do our initial evaluation, we just obviously we try to see, can we cure what's going on, or can we just palliate and help improve what we call the activities of daily living.
Great. Thank you very, very much. A lot of great information. And if you need more information, just call the AZ Pain Centers. They accept most insurance plans. Schedule a consultation. The number is right there on your screen. And to learn more, go to www.azpaincenters.com. AZ Pain Centers, our sponsor of Sonoran Living Live.